This video is for you if you or perhaps someone you know is recovering from COVID-19. I'm Ruth, I'm a physiotherapist at Complete Pilates, and I've teamed up with Professor Howard Branley, consultant respiratory physician, and Emily Lockwood, who's a specialist respiratory physiotherapist. We want to bring you some expert advice and information about your recovery and how each of us may be able to help you with your rehabilitation and recovery after the virus.
Hello, I'm Howard Branley, a consultant physician in respiratory medicine. I've been seeing lots of patients recently with COVID pneumonia. So if you've been troubled with things like breathlessness or chest pain, cough and fatigue, these may be due to your COVID pneumonia or possibly some of the complications that might happen, such as blood clots on the lung or scarring, both of which are quite uncommon. What we tend to do when we be looking at a patient who's had these sorts of problems is consider whether it's due to the COVID itself or whether it's a worsening of a pre-existing condition such as asthma that you might have. So the approach that we'd take is I'd have a consultation with you and we'd talk through your history and any medication that you might be on. Then I might need to arrange for some tests, which might include blood tests, a CT scan, possibly some breathing tests. Once we've got those results, we'll then have further consultation and I can then decide with you whether we need to refer you on to any further specialists such as a cardiologist or indeed a specialist respiratory physiotherapist.
So are you struggling for breath when you're at rest, perhaps watching television? Are you feeling short of breath doing simple activities around the home like doing the washing up or taking a shower? Are you feeling just really tired and really fatigued? These are all things that we're hearing are really common post-COVID or post-suspected COVID. So first of all, please don't worry. The main things for you to think about are you staying hydrated and are you getting enough rest? Is your chest clear of secretions? This is really important. And although we know that coronavirus doesn't typically mean that people will have a productive cough, it will more be a dry cough. But this doesn't mean that you can't get a chest infection or a bacterial infection on top of this, particularly if you have an underlying lung condition. Sometimes our breathing pattern can change, particularly in response to a period of illness. Breathing at rest should be effortless. We don't normally give it any thought. So it should be in and out through the nose. It should be rhythmical, so all the breaths should be the same size. It should be silent, and it should happen from the lower chest, so the diaphragm. And as we breathe in, the diaphragm will flatten down, and this pushes our lower rib cage out, and consequently, it will cause our tummy to rise a little bit. So just have a look at your breathing pattern when you're sat listening to this video. When you start to feel a bit better, it'll be time to get moving. So can you go out for a walk? Can you walk to the end of your road and back without feeling breathless? We know that it's common to feel breathless following COVID. So just take your time, take plenty of time to rest. Pacing is really important. And split this up into small, manageable chunks throughout the day. Could you do some exercises around the home? For example, sit to stand exercise, going from the sitting position to a standing position. As respiratory physiotherapists, we can help with all of this, as well as direct you to other healthcare professionals should we think that you need another opinion or further examination. If you've been given some breathing exercises in hospital, it's important to continue with these. Or if you would like a refresher, or perhaps you want to have them progressed, then just get in touch. As you get stronger and have more energy, it'll be time to start rebuilding your strength. And that's where physiotherapy-led Pilates comes in. Ruth, tell us more.
When you've had a virus such as COVID-19 that affects the respiratory system, the focus initially is obviously going to be on your breathing and your lungs, as we've heard from Emily. This will also take into account the fatigue that you might be feeling, which might limit the amount of activity you can do. But don't forget that a virus such as this does have an effect on the whole of your body. And that's not only from the virus, but from potentially any resting in bed you might have done, or if you've had a hospital stay. Our bodies really do stick to the "if you don't use it, you lose it" saying, which means that if you've had some time doing a lot less activity, your body will need to build that strength and mobility and range of movement back up again. We adapt really well. The human body is amazing, but it will take you a little bit of time to get back to where you were before. And the best way to do this is by following a specific program for you, taking into account your medical history, your experience with the virus, and what your goals are, what you want to achieve. I would really recommend seeing a musculoskeletal physio or clinical exercise practitioner so that you can get a program that is designed just for you and is going to give you the results you want without being too much and meaning that you potentially overdo it. At Complete, we use Pilates. This is a great form of exercise that works not only your core strength, but your global body strength, your body movement, your range of movement, and particularly your quality of movement. So no matter if you're wanting to get back to cycling or swimming or golf or tennis, we can look at that and make sure you've got the movement you need and the strength you need to do it safely and effectively. So where should you start? Well, getting in touch with a respiratory physio such as Emily would be a really good place to begin your recovery process. But Howard is going to tell us a little bit more about when you should be getting a follow-up with a respiratory doctor.
So you might be wondering, how long am I going to have these symptoms for? In most cases, people's symptoms have resolved by around 3 months, sometimes a bit longer, but usually quicker than that. And typically the hardest things or the longest things to resolve are the fatigue and breathlessness. If you've been in hospital and you've had a severe case, which might be requiring ventilation on intensive care or requiring oxygen on the ward, then you'll need follow-up sooner than most people. And that would be by 6 weeks. And really you should be having a chest x-ray at that occasion. If you've had a milder case, then we might be able to stretch that out a bit longer, but no more than 3 months. If you're concerned about any ongoing symptoms related to COVID, please do get in touch and we can have a consultation and we can see how I can help you.
If you have any questions or you need any more information, please do get in touch. We're here to help and we would love to hear from you.